So we're meeting today for a peer learning exchange on heat resilience in the healthcare sector. And we can move to the next slide to have a quick overview of the speakers. So we're joined today by Marit Grönwald, that I see in the audience, so I'm happy that it worked out with the link eventually, who's the Health and Climate Officer at the Department of Public Health in the city of Dresden. Then Maria Binder is joining us from the Dresden Hospital as a climate protection manager. And then still from the Dresden pilot, Sina Lehmann as a specialist for gynecology and also active in the Health for Future Dresden. And we're going to hear more about that in a minute. Then from Grenoble, a city in France, we're joined by Emmeline Lagrange, who is a neurologist at University Hospital of Grenoble. And then from Barcelona, Anna Riuyena is joining us from Raval Nord Primary Health Center in Barcelona, and she's working as a nurse in the health center. And feel free to add more about yourselves when your time to speak comes. But we can go to the next slide to give a very, very brief overview about the topic of today. So we're going to talk about the impact of heat on public health services and health workers in particular. The heat impacts on the human body are quite known by now, and we're talking about increased mortality rates, incidence of health issues such as heat strokes, kidney damage, etc. But something that is sometimes a little less discussed is that extreme heat also impacts public health services, and that healthcare personnel are a very at-risk group in society. And this is because various reasons, and you'll hear more about it from the speakers, but this includes increased patient inflow, putting pressures on the healthcare systems, and also healthcare facilities themselves often not being equipped for rising temperatures, which exposes both patients and healthcare professionals to higher health risks and reduces the ability to operate effectively during heat crises. And the reason why we try to have a bit of a mix of city officials and healthcare workers in the meeting today, and hopefully that is the case also in the audience, is that a collaboration between policymakers and healthcare leaders and healthcare professionals is key to address the issue. We can move to the next slide to have a quick overview of some common challenges. Of course, there's in the everyday workings of hospitals and health centers, a lack of time and capacity to respond to the issue of extreme heat, and a lack of funding, with the healthcare sector in many countries being already underfunded. Oftentimes, buildings are old or poorly designed to manage indoor temperature. And I wanted to also just shed the light on some differences in terms of competences and responsibilities. So we'll hear a lot about the Dresden Municipal Hospital being a very interesting case because it is managed by the city of Dresden, which offers quite some scope of action to make improvements to the way that the hospital is run. Whereas, for example, in France, the Grenoble University Hospitals that we'll hear about operates under the national public hospital system. So it's not directly operated by the city of Grenoble. And a similar case is in Spain. So the health centers in Barcelona, including the one we'll hear from by Anna, are managed by the Catalan Health Service, which is a regional health authority, whereas the Barcelona City Council is rather involved in urban planning at large and also not directly manages the hospital. I thought this was some interesting information to give some context. We can move to the next slide and already get into the more interesting part of this exchange. And we'll start by hearing from our Dresden speaker about the participatory process that was initiated in the Dresden hospital. So the word goes over to you, Maria, with the next slide.
Thank you, Erika. Thank you for inviting me to speak about our process with the Agora project and also with Health for Future and Marit from the city of Dresden. First I want to give a few facts about our hospital itself, just so you get a better imagination about the size and the other surrounding facts that we are dealing with. So we have like around 3,800 employees working for the hospital, and we provide care for around 180,000 patients per year, which is maybe a bit special for us. We don't only have like one place where we treat the patients, but we have 5 different locations throughout the city. sometimes with different different topics on the locations, but our campus in Friedrichstadt and in Neustadt, Trachau, those are the biggest ones where we treat many special things. Maybe something more important when we talk about the heat challenge. We have a building stock with many monument protected buildings, so sometimes it isn't always easy to change the buildings itself. Yeah, and now I would like to show a bit what exactly we have done with the Adaptation AGORA project. So yeah, in November 2023, we met the project for the first time when there was a kickoff workshop with participants from throughout the city, not only healthcare workers and different interest groups. And then we got in touch with the project, and they asked us if we would like to be like or have like one of the focus groups that they did with the different areas and different interest groups throughout the city. So around a year later, we had like 2 focus groups with 5 to 9 participants, I would say, mainly from nurse sector. And then again, this spring, we had a capacity building workshop at the hospital. And now I would like to go a bit or talk about a bit, I would like to talk a bit about the concepts of those 2 events that took place. So for the focus groups, the topic was heat waves in the Dresden Municipal Hospital with the target group nurses, as I said. So the focus was more on the nurses and the workers in the hospital itself. The goals were to get a better understanding of the problems that are associated with the heat waves in the hospital, also to identify possible solutions based on the experience from nurses, and also to evaluate engagement opportunities for them. So what we did was to have a joint investigation of the hazards and the risks during heat waves, which I will show you in a bit, but also then talk about possible solutions from the perspective of the nurses with the focus on soft adaptation measures. So the focus was not on building measures itself. And then in the end, to evaluate the engagement opportunities and how nurses can contribute. So here I would like to show you a few of the results which affect the heat on the care workers has. So what they said, or what was the outcome, is that the physical strain increases because of the high temperatures, and also the performance would be reduced, and the concentration increases with the heat or heat periods. In general, the stress increases, which leads to a higher error rate and also additional stress, going hand in hand with the stressful days that nurses experience in their work, since there is hardly time for restful breaks where they could cool down or drink enough water, which also leads to dehydration, of course. And then also some points were that during heat periods there's more sweating, which makes the hygiene more difficult, and the regular change in clothes is often not possible. So these were the outcomes, how nurses are affected by heat periods. Followed by that, we had the capacity building workshop with a more open topic, I would say. So the topic was heat stress and heat protection in healthcare itself. The focus was not only or not mainly on the nursing staff, but also on the patients. The target group for this workshop were the nurses, but all other interest groups from our staff were welcome. So there were also some doctors, but also from the administration, workers, but mainly nurses. So the goal for this workshop was to raise awareness among all the employees about the effects of heat and heat protection. This is also where the city of Dresden, in person from Madrid, and also the Health for Future network supported us a lot. Especially in the presentations, where as you can see, the first presentation was climate change and also climate adaptation in Dresden. Then we talked about the extreme heat in healthcare and risks and effects on the organism. And then lastly, we had some input regarding heat protection measures for nursing staff. This was followed by a group discussion where all the participants from this workshop could contribute. We talked a lot about the last presentation, which was heat protection measures for the nursing staff and how we could implement them in the hospital. Okay, now next slide. Yeah, here I summarized some of the results from both events. So yeah, as just a quick reminder, focus groups were mostly focused on the nursing staff, whereas the capacity building workshop was a bit more open. So you can also see that in the results or in the possible measures for heat protection. Yeah, in the focus groups, there was one possible measure, like to offer fresh fruit and vegetables as well as drinking water, which we already do, but which is not known everywhere. So also like the education is also a big measure that we have to stress here. Working hours could be adjusted. Of course, also mobile air conditioners were mentioned, but I put it just here in the spaces since the focus was on the soft adaptation measures. The workwear could be adjusted, which we did by now. Also, education opportunities should be offered, but there should also be like clear principles and guidelines so everyone in the hospital, all the employees know what to do before heat waves, during, and yeah, in regard to the patients, of course. And also the communication should be intensified so that everyone in this hospital is educated and knows what to do. For the capacity building measure workshop, we talked about preparatory measures, like offering the training that I already mentioned, but also technical heat protection measures. So, for example, getting to know the buildings better, knowing how they deal with heat waves, and also just to review our current sun protection concept and maybe develop that a bit further. Yeah, another point was to ensure the proper storage of heat-sensitive medications and materials, since many of them can only be stored until a certain temperature. Which is also very important, is to establish what I call proper ventilation. So to educate the staff how to ventilate right during heat periods, which means like to ventilate at night, and also keep the windows and the blinds closed during the day, so the heat doesn't get into the building. Also, the adjustment of food and beverage supplies for the patients were mentioned, and which is also very important to adapt the medical monitoring of patients, especially the vulnerable patients during heat periods. Yeah, and here I want to give a quick insight into the participation opportunities that our staff mentioned in the focus groups. So what is very important, at least in our house, is to have the meetings early announced, at least 2 months in advance, so they can consider it for the shift planning. Also, structured feedback processes are important to our employees, so they know that the feedback is taken seriously and their engagement in the process is seen. Also, they ask for different levels of participations. I think this would probably be the case in most hospitals, since nursing staff, but also the doctors don't always have time to take or to participate on offered events. So different levels of participation should be possible. They suggested the team meetings and staff consultations that take place regularly could be used for that. And also what I already said in the heat protection measures, that staff agreements could maybe be a pragmatic tool for implementing jointly agreed measures, which we still have to work on. Which could be less complex than a comprehensive heat protection plan. Here a quick insight on what we do at the moment for heat protection measures. We established some education offers for the hospital board managers, but also every employee can have a look at that or ask us if we can have a presentation. We established a training course on heat protection in our digital learning world. We are taking first steps to record the current conditions of the buildings, and we check if there is like an external shading system, if there are any instruments or machines that are producing extra heat in certain rooms, and we are looking at all the topics like that could influence the heat in the buildings. Also, we are working on developing a proposal for measures that are adjusted to our house, the Dresden Municipal Hospital. The working group for occupational safety is now also focusing more on the topic of heat, which is also quite new in our house. And we are working on improving the external shading systems. This is just a quick insight on different topics that we are working on. Okay, and now I would give
Thank you, Maria. Thank you so much. This was a great overview, and also just very inspiring to hear everything that can be done, also just in terms of soft adaptation measures. And we'll have time to discuss it. So I hope that everybody in the audience is also taking some mental notes of maybe interesting things that could be replicated in their context. And then we can discuss all of these options later in the discussion. Sina, are you well connected and ready to jump in for your part?
Yes, I am.
Perfect.
Do you hear me? Okay.
Yes.
Yeah, I'm Sina Lehmann. Thanks for having me. I'm specialist in gynecology, and I want to give a short overview about the organization I'm involved in, Health for Future and Klug, because as you heard, we were also involved in planning the heat event with Agora in the hospital in Dresden. And the second reason why I want to talk about this is because I hope from this organization, maybe it can set a precedent for other cities and countries and be a good example for an organization in this topic. As you can see, the organization is called Klug. It's an abbreviation that also means smart in German, and it's an organization that focuses on the intersection of climate and health, the German Alliance for Climate Change and Health. And Klug was founded in 2017 only by a handful of people that realized that climate change is a medical emergency, but the health sector in Germany did nothing about it. And initially, they were only voluntaries, but now, thanks to membership fees and funding, Klug has a permanent team of full-time staff, but still hundreds of volunteers in various working groups, like I am, for example, in the working group gynecology. And the aims of Klug are to change our own working environment in the health sector to make it more sustainable, and also putting the issue of climate change and climate action on the agenda of the medical field and politics. And especially in the medical field, it worked really, really well. Almost all medical associations in Germany have this issue on their agenda and working on it. You see below all the other organizations that belongs to Klug, like the CPHP and the educational platform, Planetary Health Academy, and also Health for Future. Now, next slide. Health for Future is like the activism arm of Klug, and it's grassroots movements in over 65 cities in Germany and a few outside of Germany. They can work independently but use the resources of the network. And Health for Future Dresden is one of them. I founded it with some other members in 2020. And initially we were 10 people, now we are stable 20 to 30 people who are active in a wide range of areas. For example, we do climate strikes, lectures, or we organize heat events with Agora in the Dresden hospital. Next slide. And the role I see for Health for Future and for Klug we can play is in general to put climate action on the agenda with our strong narrative, health needs climate protection, or also connecting institutions and people and make expertise available. In this specific case with Agora, we could support to develop the idea and the program, also connect the people like the climate protection manager in the hospital with, for example, Dr. Stelzner, who gave a talk, and use the network resources such as presentation slides or so on. And that was my very short talk about Health for Future and Klug.
Thank you so much, Stina. And I think it's very interesting, as you said, this is something that could be replicated in other contexts. And it was great to highlight the role that the network played also in this participatory process. And we would like to now move to a short presentation by Marit, who's going to highlight the role that the city of Dresden played as well.
Yeah, thank you very much. I'll keep it short. For you, it's important to know that we have in Germany we have a heat warning system, but people or institutions have to sign up to receive it, and there are no obligatory steps that follow from this. So we have a heat warning system, but no measures or no recommendations about them. So it's our work of the municipality authorities in Germany or for the institutions to deal with heat measures. And in the city of Dresden, here for me in the health department, we develop heat health action plan with short and medium term measures and focus on heat vulnerable people. So yes, the next slide, please. So I think the role of the city is like suddenly the role of a hospital. So we have to inform and sensibilize the people and professionals in their living environments or in their settings. That we inform, educate, trainings, workshops. We have posters with heat tips, and it's important for the seasonal awareness. For the second part, it's important that we look after cool or hot spots in the city and to look after more vulnerable people. And then we have cooling spaces, indoor and outdoor, and drinking water fountains and handing out sun protection. So like for homeless people. And third important part in the city of Dresden is to monitor and surveillance. So we collect and evaluate heat-related morbidity and mortality. So we analyze emergency services and causes of deaths in the city of Dresden to aware for the politicians. Yeah, and a little explanation of our collaboration between the city of Dresden and the local hospitals. I think the most important part is that we know from each other. So the hospital, municipality hospital is in charge of from the city of Dresden, but it's institution for herself, and my public health department is a department where I work. So it's very important that we know each other and collaborate in specific points. So we make together events, and for the healthy co-workers or for the patients, like in-house trainings or vocational trainings. And the city of Dresden, so the health department, supports and recommends hospital-related heat protection plans that are work together with the heat health action plan for the whole city of Dresden. Yeah, and then in long term, the city of Dresden adapting the buildings at its municipal hospital to make them more heat adapted and climate protecting. So thank you very much. It was very short.
Thank you so much, Marit, also for being very concise. I'm sure there's a lot of questions now accumulating among the participants. So you're super welcome to come back later during the discussion to add some more points or bring clarifications to some of this. Now, I would like to move to the other two cities that we're going to explore today, so Grenoble and Barcelona, and get a bit of an input about the context and challenges that are being faced in these two cities, to then have a quick exchange on solutions that are being implemented in both contexts, and then really open the discussion. So for the participants, you'll have to bear with us for a few more minutes of more frontal presentations, but then once we have all the content laid out there, you're very welcome to jump in and contribute from your side. So I'm turning now to Emmeline.
Okay.
Are you
Thank you.
okay?
Yes, I am
Laura,
ready.
maybe we
Yeah, I can jump.
move to the next
To
slide
the
then.
slide. Thank you. So I'm a French neurologist and I work in Grenoble University Hospital. It's a very particular area because we're in French Alps, surrounded by mountains, and we have no fresh air, but very high air pollution in the city. We faced a hit from June to September this year with more than 4 degrees. If we compare us to just 5 years ago. So you can see on the map the hit in the city. We are in the most preoccupating area, just over there. So we had a high number of emergencies linked to this, to the hit, with head stroke, of course, stroke, but heart attack also, psychiatric symptoms with anxiety, but also we noticed an instability of pills due to the hit, because I work in an anti-epileptic center. And we also noticed that we had a lot of violence in the town because people were no more able to sleep well. And we have really a problem of drugs and violence. And this year it was very, very hard for us in emergencies. We discovered a side effect of this because we had also a higher rate of drownings because we have lake and mountains with a very cold water also in our rivers, and we had more than 300 drownings this summer and close to 80 people dead of this. Next, please. This is for my colleague from Barcelona.
Anna, you ready to jump in?
Hi, I'm Anna. I'm a nurse from a primary health center in Barcelona. In the old part, it's the Blaval neighborhood, that it's really concrete in Barcelona and different from other neighborhoods. So first, I'm going to talk about a little bit, like little of how has been this summer in Barcelona. The summer of 2025 is shaping up as one of the hottest on record in Spain. And in Barcelona, there was like a temperature of 38.9 this August, and it has been the record high temperature of a long time ago. during all the August. Studies of future projection in Barcelona says that it will increase more or less like 6 degrees in the next years, and also we will have more warmer nights. So in order to the Raval, bueno, these two graphics, it says more or less what I have just explained. Next slide. Okay, so no, and the other, the last one, next, and the next, here. Okay, so the one before this one, yeah. So Raval neighborhood is a historic and densely populated neighborhood in Barcelona old city part, and it is known for its multicultural character, lively streets, and cultural institutions. But one of the main thing about this neighborhood is that many residents are from migrant backgrounds. So more or less the 60% of the people that is living there has born in other countries. So for example, from the Philippines, Bangladesh, Pakistan, Morocco, India, among others. So more or less like 40 nationalities. As you can see in these photos, there's like narrow streets, and so because of this dense urban form, narrow streets, and limited green spaces, Raval is especially vulnerable to heat waves. Housing also is old and poorly ventilated, which makes it harder for residents to cope with heat waves. There's lack effective insulation or shading, few windows, or these windows goes to some patios, and there's a limit of airflow. Also, energy poverty is one of the main significant things here, that maybe they have air condition or fans, but they are not using it because of the high cost of the electricity. And so here in the next slide. Okay, here you can see the first photo is the health center that I work. So during the heat waves, we see, as other parts of Europe, I think, we see more patients related to heat related symptoms. And also, as my colleague said before, like medication and treatment adaptation because of the heat because of the heat, like for example when they have diuretic treatment or heart medications. So also we have more house call, and also house home visits are needed, especially for all the people because they live in upper floors, and there's few places in the Raval that they have a lift. So it's a huge problem because there's a lot of people that they cannot go out from their apartment. As you can see here, their stairs are really limited. So you can go to the other. No, two before this one. No, the next, this one, perfect. So in order to mortality data, in 2024, Barcelona Public Health Authority estimates 240 deaths related to heat. It's more or less the 5% of the deaths between May and September from last year. We don't have now the data from this year yet. So for us, what we are coping, the health workers, there's during the heat time, it's vacation time in Spain, so there's less professionals maybe working, and so this can be a problem for us. coping the emergencies due to this topic. And also here I put some news from Barcelona, for example, that this August they had to close one of the centers, the health centers that is near my center, because the air conditioners, they didn't work. So there were two medical colleagues that they fainted, and so they had to close this center because it was not safe, not for the patients and not for the health workers. And also one of the problems that we cope, as we do a lot of home visits, as we are a primary health center, there's more people, like old people, that it's calling, and we have to follow up, and the timetable is not changing at all, but we have to adapt to this problem. And well, we were talk about the next time.
Thank you very much, Anna. And I think it's great that we have both experiences from one of the main hospitals, but also from health centers that are located across the neighborhoods, because I think it's necessary to keep these two sides of the healthcare system as well in sight. And so we'll now have a few words about some concrete measures that health workers are putting in place to face heat stress in both of these cities. So we can move to the next slide. So Emmeline, if you want to jump in and give us a bit of an overview.
So in France, we have the paradox because we depend on our prime minister, and we are in a very particular political period with a lot of instability. And it's very difficult for us to have help. But our town, our city, Grenoble, was the European Green Capital 3 years ago. So there's many things occurring in the city, but not in our hospital. And we're helping the city to redefine a new town and a new hospital, probably with health promoting neighborhoods. We are making a green walk in the city with no noise areas for people able to work during the night and so on. We are participating in the development of alternative modes of transport to cars. We fight against pollution with them. And it's a pity, but it's going to help us because of the melting glacier linked to the climate changes, we will have cold water, a big one, cold water network, easy to apply in our future buildings. We have to rebuild our hospital. And just a few years ago, we were focused on how to manage and to economize climate and warming. So warm, and now since this year, our directors are focused also on how to preserve electricity if we have to cool the hospital. So we are participating, and it's very interesting, even if you're not a neurologist, in the program called Brain Health with the European Academy of Neurology, to make probably Grenoble as the first city to prevent the health of brain in France. And that's all.
Thank you very much, Emmeline. And yes, there is a lot that can be done around the healthcare facilities. As you said, it's a lot of also what could be then accounted for as preventive medicine. But also, thank you for mentioning the fact that in the case of the Grenoble University Hospital, there will be a need to rebuild the hospital facility themselves. And this is something that is probably the case for a lot of other structures that are not anymore fit for purpose and to face the rising temperatures. Anna, would you like to explain us a bit what's been done in your context?
Yeah. Well, in Barcelona, we apply a heat wave action plan that it's been applying since I think 2003, so a long time ago, by the Public Health Agency, and this includes like early, as in other contexts, I think, early warning systems, targeted communication campaigns, outreach to vulnerable groups such as older adults, chronically people, and health services normally are prepared for increase the demand by coordinating with the different systems, health systems in the city. And also Barcelona has created like a wide network of climate refugees shelters that are including libraries or also cultural centers, schools. As you can see here in the photo is one of the museums in the Raval. And these are prepared in every neighborhood of Barcelona. So this is really interesting and is an information that we provide to all of our patients since we begin this action plan, heat wave action plan, since I think like May or April, I think that we start to say it to all these vulnerable patients that we can see that they can have more problems due to heat wave. Also at the level of the Catalan Health Institute, as my colleague Nuria More, environmental technician of Catalan Health Department, has explained it to me, because I'm not, of course, I'm not an expert of this, but she has said me that different mitigation and adaptation measures are being carried out in the primary care centers. They have been working for years to reduce the carbon footprint and environmental impact of the healthcare system, such as use renewable energy, replace lighting with LED, replace of gas with electricity in some centers, removing the gas boilers. And regarding of adaptation, they have renewed some conditioning systems, newer and more efficient. Then sectorization of our conditioning systems also, that this allows to critical areas to be cooled before than other parts. And also like systems to reduce solar radiation, like blinds, opaque curtains, these kind of things, in order to yeah. And also like the city, like everywhere else, like you can go to the next slide. Okay, has no quick fix. So what the city have, and also I think mostly all the parts of Spain, because Barcelona, it's not the worst city that is coping with the heat waves, but it's one of them. But maybe in the south of Spain, they have more problems. But what the cities does have is a deep history of handling the heat with common sense. No, so when we explain it to the patients, they said normally that they know all these things, but we have to say it again, and suggest, as so I think one of the first colleagues that has talked about, no, here we have a culture of keeping the windows down during all the day, and then with the blinds closed during the day, ventilate at night if cooled, taking like cooler showers before going to bed, avoiding physical activity outdoors, these kind of things. And there's one I will share with you, one article of the New York Times that it was like a month ago, that it's called Spain's Old Ways May Show How to Keep Cool. And there are some cultural things that we normally do. And as a health worker, what we are trying to do is adapting our time, not timetable, because we are working the same hours, the same days, all of these things. But it's true that, for example, in order to visit the homes, that this is the thing, the more difficult thing that we are coping with, We try to call before. If it's not an emergency, we will try to reschedule the visit to another day. But if it's an emergency, we have to go, and so it's what it is. But it's true that there's like a big window to improve, because I think that we have to work more on protect the health workers. As I said before, last August there were two colleagues that fainted, and this is really, well, this is really difficult to deal with.
Thank you, Anna, and for pointing this out at the end as well. And clearly, it's great to hear that the health workers are putting some measures in place from the bottom up, let's say, but hopefully there will be also guidelines and regulations that are going to be adapted to face this heat crisis. And I think that in this sense, the Dresden case can be quite inspirational of what can be implemented and at least explored within the hospital. The last words that you said also about the cultural adaptation measures really remind me of one of the previous events that we have done together with also Emilio from Valencia, who's in the audience, in which we explored a lot of these cultural adaptation measures that do play quite a big role. So you're all invited to check that event out if you want to hear some more about heat adaptation measures in that sense. And I'm happy that we have still 25 minutes. So I would really like to open the discussion, and maybe we can turn to the next slide to activate from your side a bit. We would like to invite you to write in the chat where you're calling from and what organization you represent, if any, so that we can get a sense of who is connected with us today. Hopefully we are quite a diverse group. So you're very welcome to take a moment to write this in the chat. And at the same time, I would really like to open the floor. So if you have any questions, reflections, reactions, if you have any solutions or measures that you are implementing in your context that could be that could be interesting for the rest, this is really one of the key questions we would like to explore. So what other solutions could be explored and what would be needed to implement them? Because there is a lot of ideas and maybe some implementation challenges as well. I see that some answers are coming, so thank you for that. Don't be shy. This is meant to be a very informal exchange, so let's make use of the time that we have. And this as well for the speakers, if you have questions or observations that you would like to exchange respectively, you're very welcome to do that. And you're also invited to turn on your camera. I see one hand raised from Adina Elisa Kroitoru. I hope that I'm pronouncing this correctly, probably not, but feel free to unmute yourself.
Okay, thank you. Thank you very much. Thank you for this very interesting meeting and presentations. I'm a climatologist from Babeș-Bolyai University, Romania, and recently on behalf of the Advisory Board for Sustainable Development in Romania with another colleague of mine, we prepared a report on the heat impact in Romania based on European databases and so on. But we still have much difficulties in convincing the health sector to consider this mortality, morbidity data and the real impact of the heat. So I would very much like to ask our colleagues who are presenters today coming from the health side, let's say, what would be some key issues, how we can engage and have on the same side of the issue, the health systems. Thank you.
Thank you, Adina. Elisa, that was a great question. Would anybody of you like to respond from the speaker side? Feel free to just unmute yourself and jump in. What do you think would make this work more effective, and how to engage the health sector on this topic?
Yeah, I think I try to answer because it worked very well in here in Germany with the organization of Klug, and I only can tell from the experiences we made here in Germany because we had this little network of Klug, and they, in the first time they tried to talk to people they know from each other because in Germany the health sector is very well organized. We have a lot of associations, and they are all connected with each other. And there were a little group of people who were also doctors, so they had trust in these medical associations, and they tried to put it on the topic. And yeah, what they did is to put it from the top to the bottom, but also from the bottom to the top on both sides. And very important was were the personal relationships between the people, and to talk from a doctor to a doctor that it is really not just a climate crisis, it is a health crisis, and we will all be affected by it. So
I think also that maybe should be a good idea to check the data that it has been recollected in other countries, that they have a huge story of heat waves, that it has been collected during a long time ago. And I think maybe with this data, you can put the importance of this topic in the health system.
Thank you, Anna. And maybe this could be a follow-up question also to Adi and Elisa. Would you see in your context the possibility of starting a process like the one that was put in place in Dresden? So a participatory process with hospital staff to discuss these issues?
We hope so. We hope so. But anytime when we talk from the Ministry of Health to hospital managers, they say always. Actually, they don't use exactly the same words, but the idea is the same. We have other emergencies in the health system in Romania, and this is not an emergency for the next 3 days. So this is what they respond in one way or another, but the idea behind it's something like this. So it's very, very difficult to approach them, even as individuals. We tried, because my colleagues in preparing this report is a medical staff. Now he works in research, but however is a doctor, and try to use his personal connections, but it's still very, very difficult to convince medical staff that maybe also, as you said, they are in danger of overworking, dehydration, and let's say having some error because of combined stress in the hospitals, especially in the small hospitals the hospitals in the small cities, which are not, which do not have either conditions and so on. But yeah, it's really, really difficult to approach them. We'll try to maybe involve them more. I was thinking to have this this kind of examples, like you presented today, to share with them the examples from the other medical systems. Maybe to work something like this, or to involve them in a direct project like partners or something like this.
Thank you. You can always.
However,
also...
thank you very much for the
responses, thank you for
the presentations.
Your question is very much on point, because this is also what we were hoping with this exchange to also inspire other contexts to replicate similar activities and gather inputs if anyone else has been implementing very smart, concrete measures that can help to adapt to heat. But I see that, Maria, you have your hand raised. Would you like to jump in?
Yeah, I just wanted to add maybe a few thoughts. maybe I'm talking from a different position, so I'm working in the hospital already. Also, maybe I'm more aware of the topic since my focus is on climate protection, and then sometimes also on climate adaptation, of course, for especially regarding heat. But what we do, the heat waves, it's also a occupational safety topic. I don't know how the regulations are in Romania, but as a company in Germany, you are or you have to care for your employees regarding some occupational safety topics. And so for us, at least it works when we talk about caring for the employees, then just maybe, or how we can protect the employees. It works when we use that that I don't know, that event or that topic to also talk about how we can protect the patients, because we are not how do you say that? We don't have like this rule, that regulation that we have to, I don't know, adjust the temperature in the buildings or something for the patients, but this would work for the employees. So I don't know if this could be like a point, or that you can address, focus on the employees, and then try to widen up the topic to the patients in the end. But I don't know the regulations in Romania, so.
Thank you very much. Good point, because I don't know exactly if there are regulations, but in Romania for heat exposure, but mainly for outdoor workers. So not for indoors, but maybe we can try to introduce there some regulations. I will check, however, but that's for sure we have for outdoors workers. Yeah, but it could be another point to approach. So to give them some concrete examples, like hospitals in other countries, and also this regulation. Yeah, we try to gather as much information and approaches as we can to improve this, let's say, their reaction. Thank you all.
Thank you for this. And I read that in the chat that statistics could also help, of course. And for example, in Portugal, the TV is very on the spot when there is a difference in death numbers during a heat wave. So also to make this clear in the public. We still have some time, so I would like to open the floor again if there's any examples, or I see one hand raised. Gloria? We cannot hear you. I see you are unmuted, but there might be something wrong with the audio. Try again.
Yeah, can you hear me?
Yes, now it's working perfect. Thank you.
So I'm Gloria. I work in the climate office in the Barcelona City Council. And listening to Anna review information, thank you, Anna, for the presentation. From our office, we are developing the climate shelter that she was talking about. And I don't really have a question, it's more a comment, and it's about the importance of defining the governance of all the decision making, right? Because Anna is working from one administration and I'm working for another one, and we're working in the same city. So in Barcelona last June, we just published the heat plan. I invite you all, if you want me to, I can send you the link. And one of the objectives of this plan is to define this governance when it comes to decision making in the heat terms, right? Like in the climate, like there is no sense in developing a climate shelter network if we cannot inform the citizens that we have this network. And one of the main places that vulnerable people are informed is in the healthcare centers, right? But the healthcare and the climate shelter are not from the same administration. So it's very important to define how we give the information, not only from our administration, but also from all the administrations that are involved in the process. Right. So that's like, I think like governance is a clue, like it's a key factor when it comes to heat management in the cities.
Thank you for sharing this.
Yeah,
Oh, sorry.
I think it's not the only city, Barcelona, that has this problem. Well, not a problem, but this situation of different administrations in the game, right?
Absolutely. And I also hear from the participants that it would be great if you could share the link to the plan, of course. And maybe actually, would you like to explain to us how this information was then transferred? So how you engaged the health centers in making sure that citizens are informed about the climate shelters?
So, well, not only in climate shelters, but also any decision making that is related to heat. So, to develop the heat plan, we made a study of all the administrations and all the groups of people who may be involved in any sense. So, just in elaborating the document, all these sectors were already involved. So CatSalud, for instance, is already involved in the elaboration of the heat plan, because some of the actions that we decided that we want to make in Barcelona city are not in our hands, like from the city council. They have to be involved somehow, like also ASPB, which is the health, like La Agencia de Salud Pública, like public health agency here in Barcelona, and also the public health agency in Catalonia, like in the region. Like there's so many different administrations in Spain. I don't know about the rest of the countries in Europe, but it's just crazy. So everything you want to do, there's so many people, like different people from different groups which are involved in the decision making, that first of all, we had to define which are these groups of people, which are these administrations that have to be involved in this decision making, in these actions, like defining these actions that we want to include in the heat plan. Like every action that we wanted to do, we had to make a study of like, okay, who is the one responsible to making the decisions that are necessary, or I don't know, So in every action in the plan, you can see which are the agents that are involved somehow in that action. Like the heat plan is coming from the city council, but it's not only the city council who's the responsible to making sure that these actions are taken into place. Yeah. So I don't know. That's how we made it. But
thank you.
So like we made a very deep study of other cities. Like we think like when things have already been done, there's no sense in doing things from the starting point, like if somebody thought about it already. So I think it's also very important, like Barcelona from the city council is involved in many international projects like this one. So it's always very good to know the case studies of other cities, how they have been doing it already. So we can, I don't know, every city is different from the others, but some things can be applied and some others cannot, depending on the size of the city, the population density, and all that. So, yeah, these are some ideas that came into mind now.
Thank you, Gloria. Absolutely. That's also exactly the reason why we organize these kind of events, because otherwise there are not many chances to get in contact with each other and see what's already out there and how we can learn from different experiences. So thank you for contributing to this as well. I see there's a question in the chat also from Eulalia about how science has been included in the governance of heat health measures in the different cities. And with particular reference to the fact that science policy interface is often mentioned as a challenge, and Klug seemed to be quite a good example in this case. So happy to hear from any of the speakers if you would like to say a few words about this sort of how science has been included in the development of these measures. And I hear one immediate reaction from Emmeline in the chat, but I don't know if you want to add something also.
Oh, the city of Grenoble is really different maybe from others because in our university we have one of the best in Europe biological studies for climate change and health, and we have the reporters of the GIEC, the shift also. So all of the scientists were used as experts by the city to adapt the city and all of the program of the city, but also to measure air pollution in different parts of the city and the heat also in the city to adapt it. And we also have a partnership to focus on how many stroke and heart attack we have linked to the air pollution of the heat. So to be focused on certain neighborhood, but could be the most sensitive to readapt about climate change.
Thank you, Emmeline. So there's a very strong partnership in the case of Grenoble with the university. I don't know if any of the other speakers would like to say something about this. Otherwise, we also have a related question. Do you have any needs of technical support and knowledge to back up the process and support decision making? The person asking this question assuming yes, but it would be great to hear what are the most relevant areas for scientific and technical partners to provide support, to support decision making. I don't know if the question was clear enough. So in terms of the particular areas for scientific and technical knowledge to be provided to back up this decision-making process. I hear Emmeline mentioned strokes and so like the incidence of certain diseases, I guess, connected to heat. But I don't know if there's anything else to be added here, or otherwise also Antonio Arce-Romero, if you would like to jump in and elaborate, you're also welcome to on your question.
Yes, thanks so much for the presentation. Indeed, I hear that there's different needs from different angles. So of course, time and resources to actually implement and engage with the different stakeholders. But my question was indeed mostly from the knowledge point of view, the technical point of view as well. Is there any need, and where could be the most or the best place for scientific institutions to provide this support?
Maybe I would jump in. From our point of view, there's already so much knowledge and information and material out there. It's honestly more a resource question and a question of how to communicate all the knowledge to all the workers and employees. So we don't start from zero. We use what's out there. For example, there are like heat action plans for hospital that were developed by the government, or I don't know, probably Klug was also involved since Klug works also with the government and tries to address the topics. So it's not really a question of information available, but more about how to communicate inside our company or our hospital. Yeah.
Thank you for this. I don't know if there's, or Antonio, would you like to reply? Feel free.
No, thanks for the insights.
So it's a lot more about communicating existing knowledge in a way that is effective more than creating new one necessarily. There's one question in the chat asking if it would be possible to have, or Maria, would you like to add something?
Yeah, and
to
what I forgot to say, maybe also implementing structures in the hospital, telling or giving responsibilities to certain people and stuff like that. It's more about that in the end, yeah.
Yeah. Thank you for that. There's one question. We only have 1 minute left, unfortunately, but someone in the chat is asking if it would be possible to have the presenters' emails to deepen any question later on, and I would leave it up to you. So if you wish to share your email, maybe you can write it in the chat if you wish to be contacted after this event. We will surely share with everybody not only the recording, but also some resources that have been shared and that have been collected also on the project's community hub that Benedetta linked earlier in the chat. There are more resources. But with this, we unfortunately have to end this meeting. And I hope that this is somehow the start of a longer discussion, because I think that there's a lot of insights that can be shared. And I heard, for example, Alexandra Castro, without putting you on the spot, that you're starting conversations with the health team in your city. So I'm assuming that there's there, for example, further opportunities for learning from each other as you engage in this process. So yes, thank you for sharing your emails in the chat so that people can be able to contact you again. And thank you so much to all the speakers. It was very valuable that you participated and shared your experiences. So thank you for your time, and thank you for bearing with the technical difficulties of today. But I hope that it was still a very interesting little exchange for everyone. I think we've potentially only scratched the surface of this very big topic, but hopefully there will be more of these conversations, because I think this is a topic that is sometimes a bit underlooked. But yeah, hopefully we will continue this work also together with you. So thank you very much, and enjoy the rest of your day.